So question number 5 is 30-year-old presented with features of acute pancreatitis. Patient has acute pancreatitis and few days later he developed the dyspnea. His chest X-ray is shown below. The probable respiratory failure is. So you have to make a link between the clinical feature which is given to you. So the clinical feature here is of acute pancreatitis followed by dyspnea. And if you can see the chest X-ray, so the chest X-ray shows a bilateral opacities. So this bilateral opacities is most likely a case of patient has developed here ARDS. So alveolar filling is there. Patient has developed the ARDS here and they are asking ki what is the type of respiratory failure, typical respiratory failure in cases of the ARDS. So answer here is a type 1 respiratory failure. So if we look at the type of the respiratory failure and their examples. So the type, mechanism and the cause. So the type 1 respiratory failure is mainly a alveolar fluid, and the causes are ARDS, or it can be cardiogenic pulmonary edema like CHF, pulmonary edema, heart failure can have a type 1 respiratory failure, alveolar fluid. While the number 2, the type is, it is because of hypoventilation. So the causes of the hypoventilation include the respiratory center inhibition due to drugs, due to head injuries, trauma, any cause of respiratory center inhibition, or neuromuscular disorders. It can be late stages of COPD, while type 3 is because of alveolar collapse. And alveolar collapse, it is during the perioperative time. While number 4 is due to decreased respiratory muscle perfusion. It is seen in cases of shock. So these are the different types of the respiratory failure. So let me see who will give me the correct answer here with some other underlying mechanism here, or maybe the similar mechanism which is not written here in the cause. So let me see. If the question to you is hypothyroidism, this is a question which has come to you. So tell me, hypothyroidism will cause which type of respiratory failure out of 1, 2 and 3 and 4? So this question have come. Hypothyroidism, you will put in which group? Yes, your answers. If the X-ray is not given in the question, can we mark type 3? Usually pancreatitis followed 1 week later by the dyspnea is most likely ARDS. So it will be ARDS. While type 3 will be operation, during the operation, but there is no as such history of operation given here. So it is unlikely. Yes, it is hypothyroidism. Yes, good. Hypothyroidism comes here. Now, what about the pulmonary embolism? Where will you put pulmonary embolism? The type of respiratory failure of pulmonary embolism. Yes. Type 1, type 2, type 3, type 4. Yes. Ravi has given the answer as type 1. Pulmonary embolism. Yes, pulmonary embolism is due to multiple mechanism come in type 1. Yes, pulmonary embolism is type 1. type 1. Same for asthma. Remember, asthma is a type 1 typically, but if it is advanced or severe, then it is type 2 also. So it comes in both the categories. So severe asthma can be type 2 and just plain asthma can be type 1. So you have to identify what is the options given to you. You have to compare with the other options and then mark your appropriate answer.